Hi, this is QD Clinic. I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live, where you can get connected to a truly memorable meeting and faculty. Today's episode is called Blinded by Noncompliance. I know I've talked about noncompliance in the past, but I came across some notes that I have been collecting on this issue because I struggle with it just like you do. I'm sure you're aware that the data is really quite shocking about how compliant patients are. You know, an old Consumer Reports study showed that patients who went to their family doctor for a prescription for an infection, less than 50% filled the prescription for the antibiotic. They went to the doctor for the antibiotic, but yet only 50% filled the prescription. Our data is about the same. It's about 40 to 60% of our prescriptions are either not being filled or not being taken correctly, meaning substantially less. So this issue of noncompliance is a dramatic one and may underlie some of our difficulties in disease management. You know, the general measures here are pretty simple. It's education, it's handouts, it's often a relationship that really is important in overcoming that gap between your writing a prescription and their taking it. You have to recognize the patient's frustrations and limitations and worries, especially if you're a new doctor to them. Yes, they came to see you for relief, but they really came for an explanation and some alternatives and whatnot. They didn't really want to walk away with a handful of prescriptions on drugs that they know nothing about, especially when they don't know you. So you have to recognize their frustration. They have to know your degree of urgency. If this is really urgent, you need to tell them, I know that this is a new thing, but you need to say that if you don't take this, what the consequences are, meaning we need to get a hold of this right quick, or we can sort of, you can tolerate their noncompliance and their slow ascent into disease control. So here are some of my notes on how you can help the problem of noncompliance. Number one, require, mandate, beg that they always bring another person to the visit. Again, that's their personal secretary, their other eyes and ears who will remember all the things the patient will forget. Very, very important. Second, make them bring all their medicines to every visit. This underscores, one, maybe that they're taking too many medicines, and you can help against the third problem, which is reduced polypharmacy, but it also is your chance to educate them on the importance of every medicine, which to take, how to take, when to take, etc. Third, if you're going to prescribe a drug, stop a drug. Polypharmacy is a gigantic problem amongst the people who are not taking medicines. Fourth, if you really think they're not taking the oral medicine, change over to an IV form when possible. That's very possible with a lot of RA therapies. You could use IV abatacept or IV tocilizumab instead of the sub-Q forms, for instance. Next, more frequent visits. That's your opportunity to create a relationship, build trust, and educate the patient, and to reinforce the importance of the medicines that you're prescribing. 6, teach that basically taking less medicine is dangerous. Taking less medicine means less disease control. Less disease control means worse outcomes. Patients think it's safer if they take less. Again, I've said it before, I'll say it again, the longer they take a drug, the safer it is. Drugs like methotrexate, drugs like TNF inhibitors, etc. Often the longer they're on them, the more that they can be assured that it's got proven efficacy and proven long-term safety. These are difficult issues, but then again, you're a rheumatologist. You can fix this. Tune in for more QD Clinics.